Hey doc, I hope you are doing great. Today we will be discussing about chickenpox, its causes, symptoms, complications and management. Chickenpox, also known as varicella, is a highly contagious disease. It is caused by an infection with Varicella zoster virus. Varicella zoster virus is one of 9 herpes viruses known to infect humans. Varicella zoster virus produces 2 distinct diseases: a primary infection which appears as chickenpox and a reactivation infection called shingles. Firstly, we will be discussing about chickenpox or varicella. The Varicella zoster virus spreads through respiratory secretion. The rash caused by chickenpox infection appears 10 to 21 days after exposure to the virus and usually lasts about 5 to 10 days. Once the chickenpox rash appears, it goes through 3 phases. Firstly, it is a raised pink or red bumps called papules, which break out over several days. Small fluid-filled blisters called vesicles, which can break and leak. And finally crusts and scabs, which cover the broken blisters and take days to heal. Other signs and symptoms, which may appear 1 to 2 days before the rash, include fever that may be high, loss of appetite causing weakness, headache, tiredness and a general feeling of being unwell. Chickenpox is normally a mild disease, but it can be serious and can lead to complications including secondary bacterial infections of the skin, soft tissues, bones, joints or bloodstream due to scratching, infection of lung parenchyma called pneumonia, inflammation of the brain called encephalitis. It may also lead to toxic shock syndrome, which is a life-threatening illness caused due to bacterial toxins. This may result in high fever, low blood pressure and vomiting. It can also cause Reye syndrome in children and teenagers who take aspirin during chickenpox. Reye syndrome is an acute condition that causes swelling in the brain and liver needing hospitalization. Let's discuss risk factors involved in pregnancy due to this virus. Low birth weight and limb abnormalities are more common among babies born to infected women. When a mother is infected with chickenpox in the week before birth or within a couple of days after giving birth, her baby has a higher risk of developing a serious infection. In order to manage chickenpox, antipyretics are prescribed to reduce fever, antivirals like acyclovir to control viral replication, and antihistamines are prescribed to reduce itching. Let's talk about Varicella zoster immunoglobulin. Varicella zoster immunoglobulin is used to prevent exposure of varicella virus in high-risk individuals, such as children with weakened immune system, pregnant women, premature babies, babies younger than 1 year of age and other immunocompromised individuals. The chickenpox or varicella vaccine is the best way to prevent chickenpox. In young children, 2 doses of the varicella vaccine should be given. The first between ages 12 and 15 months and the second between ages 4 and 6 years. Unvaccinated older children of age 7 to 12 years who haven't been vaccinated should receive 2 doses of the varicella vaccine, given at least 3 months apart. Children age 13 or older who haven't been vaccinated should also receive 2 doses given at least 4 weeks apart. Let's talk about shingles here. Varicella zoster virus becomes dormant in dorsal root ganglion of sensory nerves. When it is reactivated later in life, it causes shingles. Shingle causes a painful rash that is unilateral and restricted to a sensory nerve, therefore it is called dermatomal rash. It is common in older patients. The most common site of these rashes are thoracic dermatomes. Complications from shingles can include postherpetic neuralgia, which is the most common complication of shingles. It occurs when damaged nerve fibers send confused and exaggerated messages of pain from your skin to your brain. Shingles can also lead to corneal damage, causing vision loss. It can also cause many other neurological problems. That's all for today. Please subscribe to our channel. We hope to see you soon. Bye doc.